Assalamu alaikum. I welcome you all in this lecture. Today we are going to learn about the Alfred Knudson two-hit model. So in order to understand what this model is, let's start with one simple and straightforward example. The example is of a retinoblastoma gene. This retinoblastoma gene is generally called as RB gene, and it is basically responsible for the formation of tumor in eye. So once the tumor is present inside the eye, the tumor formation may be of two types. Either it is involved in both eyes, that is called as bilateral retinoblastoma, or if there is a one eye involvement, this is unilateral retinoblastoma. In one, and the picture you are looking right now is basically showing an optic nerve extension pressure on the cornea. Now, if you look at the A part, you can see this is retina pigment epithelial cells, RP cells, followed by rods and cones. The nuclei of both rod and cones are located in the ONL, that is outer nuclear layer surface, followed by outer plexiform layer, then inner nuclear layer, followed by inner plexiform layer. Then there is ganglion chorion layer, and this side is actually where the light is actually exposed. This is the outer surface of our eye. Now, in the retinoblastoma actually begins in inner plexi inner nuclear layer inner nuclear layer. So an abnormal growth of cells happening inside this region of inner nuclear layer cells turn it to retinoblastoma formation. And this unilateral retinoblastoma is actually a sort of sporadic tumor formation which is happening in 1 in 20,000 in children, and it is relatively late as compared to bilateral retinoblastoma where both the eyes are involved. Now, based on the disease reoccurrence pattern has been observed that after the treatment it has been noticed that unilateral retinoblastoma patients usually live a relatively disease-free or cancer-free life for up to 50 years with a modest prevalence of certain other complications from 5.6 to percent, so it is roughly around 6%. The story of bilateral retinoblastoma affected patients, even treated, there is a 30% risk of osteosarcoma cases, but this varies depending upon the genotype and diversity and certain other factors. But again, this risk is slightly higher, or two times or three times you can say it's higher than the unilateral retinoblastoma. I am not talking about explicitly the case-wise base. I am talking out on a holistic level. The total cohort yield says 36% osteosarcoma. It is not the one individual I am talking about is more affected with bone sarcoma. All right. Then the pattern of this retinoblastoma shows that there is a history of this infection or retinoblastoma affected over here with a square followed by a round. This round circle is basically indicating the females, squares are the males, and the green sides you are noticing are the retinoblastoma patients. Okay. Then what Alfred Knudson two-hit model says, it says that if we distribute just the kinetics of the disease, we notice that the bilateral retinoblastoma patients cases are happening in majority within less than 2 years of age. Okay, majority you can see that is within 10 to 20 months window. So majority of these cases are falling at a very early child age. So both the eyes are affected. While in case of unilateral retinoblastoma, there is a one there is not one hit which is required. Due to the addition of two hits, there is a gradual increase in the age, and this age is providing an advantage and giving a notion that two hits are required exactly on the same RB gene involving both alleles to start unilateral sporadic retinoblastoma impairment. Okay, that's what Alfred Knudson two-hit model concludes. It says that there are germline mutations which are already present, and just one somatic hit provides an advantage and the story begins. Now, in familial retinoblastoma, like we have mentioned in square and green circles you have noticed in the previous slide, there is a mutant RB allele which is present in each cell. This is a chromosome number 13, but the patient is still acting as a carrier. First somatic mutation induces two mutant RB genes leading to a bilateral retinoblastoma. Both eyes are affected. However, in normal physiological individuals, there is one hit of mutant RB followed by a second somatic mutation. Two mutant RB gene copies form a unilateral retinoblastoma affecting just one eye. This is a late age event, this is an early age event. Now, this is what Alfred Knudson explored, that two hits are required for a cancer sporadic in nature to begin with. First somatic mutation and then the second somatic mutation. Thank you very much for your understanding. I wish you all the best. If you have any questions, please feel free to write.